Okay, so the first thing that we're going to look at in this presentation is the foundation principles of trauma-informed care. So first thing is the 8 core values and best practice of trauma-informed care. The first one that we're going to look into is the understanding of trauma and its impact, which means that it's all about understanding how traumatic event can have an impact on the person currently, and how every individual has a different response to their trauma that can actually affect their current behavior. The second thing is about promoting safety and how it's so important for a support worker to establish a safe, both emotional and physical environment at all time, making sure the client feels safe physically but also in an emotional way. Third thing is about ensuring cultural competence, which is about understanding how cultural context can influence the perception of any response to a traumatic event, and keeping in touch a connection with our own experience of cultural background and our own understanding of it. The next thing is about supporting the individual to have control, choice, and autonomy. So how, as support worker, can we assist the individual to regain a sense of control over their daily lives, build their own competence, and strengthen their sense of autonomy? So that's really important. Then the next one is about sharing power and governance, which is all about promoting democracy and equalization of power differentials. The next one is integrating care. So that is about maintaining a holistic approach of the person. So how can we see the individual as a whole, not just their condition, not just their diagnosis, but the whole person with their own experience, their own trauma, their own support system as a whole individual. The next thing is healing happens in relationships. So that means that it's really important to understand that safe, positive relationship can really help the recovery, because feeling supported, feeling like those people have a group, a network, is just really important. The next thing is about recovery is possible. So understanding that recovery is possible for everyone. So not just for others. That's sometimes how clients can feel. But it's all about understanding that there is hope, there is a future, and really focusing on those goals to recovery. Here it's all about the principles of recovery-oriented mental health practice. So the first one is the uniqueness of the individual. So really focusing on the idea that the individual has their own unique strength. How do I support the client to build their own stress? How do I consider the possible effect of trauma in their lived experience? Second is about real choices. So as a support worker, we can ask ourselves, do I provide sufficient information to support the client to make their own informed choices? Do I try to understand the client's perspective when they're making those difficult choices? The next thing is about attitude and rights. So making sure that we respect and promote the client legal and human rights. Do I encourage the customer, the client, to promote their own legal human rights? The fourth thing is about dignity and respect. So do I make the environment physically and emotionally safe for the client? How can I make it better? How can I make them feel safer? Do I listen to them? Do I support the client to define their own recovery goals? All these kind of questions. The next thing is about partnership and communication. So what we can ask ourselves here is, do I proactively involve the client in their own individual care planning, in their own treatment? Um, how do I link other services and supports to facilitate the client's recovery goals? The last point is about evaluating recovery. So how do we use the client's feedback to improve the service delivery? How, as a team, do we assess and evaluate the recovery outcomes? Do we have the right tools? Do we need to create more tools? So that's all about the 6 principles of recovery. Next, we're going to look into what trauma actually is. So, a quick definition here that we've got on the side. Trauma is when a person is experiencing an event or a series of events where they feel physically or emotionally harmed, or maybe even life threatened. So, the idea is that trauma has long lasting effect that can affect their mental, physical, social, emotional, or spiritual well being. We're going to look into what's called the big T's and the small T's trauma. So, for the big trauma, those are a series of highly disturbing experiences or situations. So, for example, domestic violence or abuse. It could be a life-threatening experience such as earthquake, car accident, events where we feel that we're at risk of death or serious injury, and a person often responds with feelings of intense fear, helplessness, horror, um, and those strong feelings can really overwhelm the person and their ability to cope. The next thing is the small t's trauma. So they're usually not life threatening. They can be highly disturbing, but not life threatening. So they're also overwhelming of negative feelings. And those can be things such as being bullied as a child, experiencing a parent separation, the death of a close person or a pet. So those are all small traumas. Small traumas, we probably all have been through them, and we're going to see as a support worker through the course of our work that often people have experienced a combination of both small T's and big T's. And so it's good to keep in mind that people have gone through this and how we can help them navigating through it. And the next thing is about simple and complex trauma. So, a simple trauma is usually a single incident trauma. So, for example, again, a car accident, a house robbery, a personal assault, something that was unexpected but has only occurred once. The complex trauma is something that involves many severe and traumatic events. So, for example, when other perpetrate or fail to protect the individual from violence or threat. So, in many situations, those complex trauma, the person might feel trapped and just unable to escape the situation that just keeps and keeps on reoccurring. So, those trauma can be things like domestic violence, where it just keeps on happening, child abuse, and situations like that.
To have a good understanding of trauma-informed care and align that with the recovery process for a person, as social workers, we need to understand and support people who come into our care who've experienced trauma. To do this, we need to look at the three E's in trauma: the event, the experience of that for a person, and the effects after that. So, the event circumstances that may include the actual extreme threat of physical or psychological harm. There are a few examples there. We've got natural disaster, violence, domestic violence, car accidents, or something like bullying as well. Um, could be another one. A life-threatening neglect for a child also, which can have an effect on their brain development throughout their life. These events for people could be directly harmful, can be directly harmful because they're could be violent, life-threatening, and also life-altering for them. It can happen accidentally, intentionally, happen as an individual or a family, or also in the community as a whole. This brings us to the next in the experience side of it for a person. What we need to realize is that every person experiences trauma differently. When there is a traumatic event, there are factors that will alter the person's experience at the time. Let's look at the age, for example. At our knowledge is different given our age, therefore our experience is going to be different. For example, an infant will have a different experience to a person, say, in their 20s. Cultural beliefs is another factor. Support networks. Example of this is at the time the person is experiencing this traumatic event, did they have any support networks around it? And if they did or didn't, this can alter their experience as well. The diversity of each individual factor and the experience can have a profound effect on how deep that trauma wound is for a person. So these can be like the physical, they could be emotional, social, and functional. They may occur immediately for a person, or it may have a delayed onset for another. It could be short-term effects or long-term. Individuals may not recognize the effects at first, and it may come up later in their life. An example of this is a childhood trauma, which it may be triggered when they have their own family, for example. Awareness and knowledge of the 3 E's in trauma in your care practices will give the person a safe environment. Understanding their experiences and the effects it has or is having on them will lead to a more self-direct, efficient recovery. Types of trauma. After looking at the video clip, it does explain one type of trauma, which as social workers we may or may not be familiar with in our workplace. Vicarious trauma, the occurring effect of being exposed to someone else's trauma. We know what trauma is, but to best serve a person and ourselves is to have that awareness and the knowledge around the types of trauma. So let's look at the first one, childhood trauma. Obviously, it happens at the young age. It impacts the child's brain development, which has a ripple effect throughout their life cycles, causing struggles with emotional regulation, depression, and anxiety. Interpersonal trauma, it occurs at the hand of another or a group. So example of this would be domestic violence, or a group would be like bullying. Next one is the historical and intergenerational trauma. Example, let's look at the Indigenous communities around that time of the stolen generation and the impact that it still has today, and that generational trauma that's there, the repetitive trauma from one generation to the next. And also we've got a couple of others there, which is situation, as it says, a particular situation, ecological, and the last one is accumulated trauma. Understanding and correlating behaviors of people and their types of trauma will help you as a care worker and help the person together to create and put in strategies that are safe and understood at a self-directed pace to implement their road to recovery. When implementing trauma-informed care, we want to look at the principles of peer support. So from our video there, the short video discussed one of the core values of peer support, which is being safe. So feeling safe to express freely, and also creating that safe environment for each other. So let's look at the others and how we can apply them in our workplace and in our informed care practice. Mutual shared experience, having a mutual respect of lived experience and the impacts of trauma. Reciprocal, shared process of problem solving. Share and explore in the process of problem solving. For example, that again, reciprocal respect in the decision making and the solutions around that. Non-directive, one does not tell what's good for the other. So an example in that means that, hey, George, I think you should do this because it was good for me and it was good for John. We don't want to prescribe to a person. Recovery focused. We want to grow beyond what has happened to the person. This is by inspiring them and giving them hope, giving the control back to them so they can facilitate their own access of opportunities for themselves. Strength-based, recognizing and using one's own strength and skills. Exclusive, help encourage and contribute. Progressive, that means growing together, which is pretty important. We want to look at their gains from their experiences, help them find their hidden qualities and assets, recognize their courage and their strength and their skills. And I think the most important thing is to celebrate the small steps that they have achieved. When it comes to the principles of peer support, we want to hold space for the person so they feel safe and understood. This is going to build trust and collaborating relationships with a person, feeling that there is hope and giving them inspiration that recovery is possible.
Thank you, Robbyn. Now moving on to the next section, what can cause trauma? Trauma can be caused by an overwhelmingly negative event that leaves a lasting impact on the victim's psychological and emotional stability. While many sources of trauma are physically violent in nature, others are psychological or a combination of both. Trauma can stem from various causes such as experiencing domestic violence. Domestic violence creates an environment of fear, control, and abuse, which severely impacts the person's physical, emotional, and psychological well-being. Trauma can arise from natural disasters such as earthquakes, bushfires, cyclones, or floods, and present an immediate threat to life, causing intense fear and panic. The loss of homes, loved ones, and a sense of insecurity further compounds the emotional and psychological impact. Being in a war zone can lead to trauma due to the intense fear and constant threat to one's life and well-being. Trauma can be caused by severe illness or injury or from being attacked due to the profound shock, pain, and distress that disrupt a person's sense of safety and security. Losing a loved one can also be a source of trauma due to the intense grief and emotional distress. Complications during childbirth, such as emergency interventions or unexpected medical issues, can lead to feelings of fear, helplessness, and pain. Trauma can arise from witnessing acts of violence or enduring violence, sexual violence, rape, assault, harassment, or bullying due to the intense emotional and psychological impact of observing or experiencing such harm and violation. Additionally, being exposed indirectly to traumatic events can trigger trauma. Many professions, for example, are regularly exposed to or involved in traumatic events, whether directly or indirectly. Additionally, the constant broadcast of traumatic events in the news and on social media can further contribute to this indirect form of trauma or may trigger past trauma. So knowing the causes of trauma is important for mental health workers as it helps them understand the diverse impacts on individuals and develop effective interventions and treatment plans. Understanding causes of trauma helps understand what's happened to a person and not what's wrong with a person. This understanding ensures a compassionate approach that addresses specific emotional and psychological challenges to promote better recovery and stability. Moving on to the next section, the effects of trauma. We could look at the effects of trauma through various different lenses, but for the purpose of this presentation, we'll be looking at the following categories: physical, cognitive, emotional, behavioral, and spiritual, and we'll be looking at these one by one in the next few slides. The short-term and long-term effects of trauma may appear similar, yet the long-term effects are typically more intense. While mood fluctuations, for example, shortly after trauma, are quite common, if these mood changes persist beyond a few weeks, they can evolve into long-term consequences. So from the physical perspective, recognizing impacts is important because they can indicate various health issues that may affect daily functioning and overall well-being. For example, fatigue, chest pain, and difficulty breathing may signal serious conditions, while nausea, dizziness, and gastrointestinal upset can point to stress or anxiety. So identifying these physical symptoms early helps in addressing potential problems and ensuring timely care. Trauma can significantly impact cognition, leading to confusion, intrusive thoughts, and memory problems. Individuals may struggle with attention, decision-making, and concentration, and experience changes in alertness and awareness. So recognizing these cognitive effects is crucial for mental health workers, as it influences how individuals process and respond to their environment. Understanding these symptoms helps tailor interventions, address clients' needs effectively, and create supportive environments to improve outcomes towards recovery. Recognizing the emotional impacts and effects of trauma is crucial because it helps in understanding and addressing clients' struggles. Identifying symptoms like crying, guilt, and panic allows for a tailored support. Awareness of emotions such as fear, anger, and depression guides effective treatment and ensures compassionate care. It's important for mental health workers to recognize the behavioral effects of trauma because behaviors can reveal how deeply trauma is affecting someone's daily life and routines. Behaviors, for example, like withdrawal, pacing, and changes in activity levels can signal distress and difficulty in coping. Changes in speech patterns, emotional outbursts, and increased suspicion can highlight emotional instability. Identifying issues like sleep or appetite disturbances, increased alcohol or drug use, and heightened alertness helps in understanding a person's struggles. By recognizing these behaviors, mental health workers can better provide support that addresses both the symptoms and the underlying trauma. Recognizing the spiritual and cultural effects of trauma is also crucial, as this deeply affects a person's belief and sense of self. Issues like moral dilemmas or feelings of abandonment by a higher power and moral injury can impact self-worth and a person's sense of purpose. So addressing these aspects helps mental health workers offer holistic support that respects spiritual and cultural beliefs, while also acknowledging the positive aspects like increased faith or community connection. This approach fosters compassionate, culturally sensitive, culturally safe care to promote healing and resilience. Moving on to the next section, gender difference and trauma. Women and men are likely to experience different types of traumatic events, and there is a little note here. It is also important to note that those who identify as transgender or non-binary are also at risk of trauma. Women are more likely to experience trauma related to interpersonal violence, such as sexual assault and intimate partner violence. This includes behavior by an intimate partner or ex-partner that causes physical, sexual, or psychological harm, including physical aggression, sexual coercion, psychological abuse, and controlling behaviors. Global estimates by the World Health Organization suggest 1 in 3 women will experience physical or sexual violence in her lifetime, usually by an intimate partner. Women are almost twice the risk of men to have PTSD. Women are also more likely than men to be survivors of childhood sexual abuse, with 25% of girls experiencing this form of abuse during childhood. Men, on the other hand, are more likely to experience trauma related to high-risk incidents. So while men also experience the impact of violence and childhood abuse, they often face trauma from high-risk situations like combat or witnessing death and injury. And considering intersectional experiences of men, including race and sexual orientation, men also experience or witness traumatic events such as injury, death, or attacks within their communities and society. Occupations such as defence force members, firefighters, and police officers are especially vulnerable to trauma and PTSD. These fields, still predominantly male, place individuals in the direct path of danger and distress. There is a caveat here. There is a need for caution in perpetuating male or female stereotypes. And it's also necessary to note that variations in traumatic experiences, though not within the scope of this presentation, occur among subgroups of men and boys and women and girls. Looking at gender difference and trauma, we can also look through the perspectives of psychological, biological, and social cultural factors. So looking at psychological factors, women often report higher levels of distress and are more prone to developing PTSD, depression, and anxiety following trauma due to both biological and social factors that influence their emotional and psychological responses. Females aged 16 to 34 were more likely to experience psychological distress than any other sex or age group. And this compares 26% with 14% of males in the same age group, 16 to 34. Men are more likely to exhibit externalizing behaviors such as substance abuse and aggression. Externalizing behaviors involve acting out one's internal struggles through observable actions that affect others. For instance, a man dealing with unresolved trauma or emotional distress might turn to alcohol or drugs as a way to cope with his internal struggles. This behavior not only affects his own well-being, but can also lead to aggression or disruptive actions that impact those around him, such as conflicts with family or colleagues. From the biological factor perspective, hormonal fluctuations such as changes in estrogen and progesterone, especially during low estrogen levels in the menstrual cycle, perimenopause, and menopause, can significantly affect how women respond to stress and their vulnerability to PTSD. Additionally, traumatic stress impacts different areas of the brains of boys and girls at various ages, potentially interfering with their neurological development. And given that women are more exposed to high-impact trauma, this means sexual abuse, for example, than men at a younger age, means they are more likely to experience impacts on neurobiological development at an earlier age. From the social cultural factor perspective, social support networks often differ by gender, with women typically seeking and receiving more support. The most pronounced gender difference is seen in seeking social support as a coping style, which is more frequent among women. Because women are more likely to show a tend and befriend response to stress, which is clearly related to the availability of support from their social network. Cultural, societal, and individualized expectations, stereotypes, and norms about gender and gender roles can impact how trauma is experienced and reported. Societal norms often push traditional ideas of masculinity, for example, such as dominance and emotional restraint, which can pressure men to avoid showing vulnerability and seeking help, which negatively impacts their mental health. On an individual level, each man's personal interpretation of masculinity shapes how he deals with emotions and relationships, further influencing his well-being and interactions with others. So we can see that an understanding of Gender difference in trauma is important for mental health workers because it helps them to provide more empathetic and customised, effective care that acknowledges the unique experience and needs of an individual, but also based on their gender and the specific impacts of trauma that they have endured.
Implementing trauma-informed care. The process of becoming trauma-informed will be unique to each organisation and needs to be tailored. The process is intended to develop a service culture whereby staff remain receptive to the change and innovation needed to promote capacity building and sustainability. Most organisations will not implement change in every aspect of their organisation, service and programs in one step. The next slides, I will talk about the 3 stages of implementation. Stage 1, planning and audit. Number 1, identify a leader in the organisation willing to champion trauma-informed care and practice implementation and organisational change. 2, establish a TICP audit implementation working group, known as AIWG, and this will include senior management and staff, consumers and carers, including current service unit users. The TICP working group drives strategic planning for organisational change. 3, determine the domains to be audited. A, governance, management and leadership. B, organisational policies and structure. C, consumer and carer family participation. D, direct services to consumers. E, healthy and effective workforce. F, outcomes and evaluation. Number 4, once the audit and analysis process is completed, then the process moves towards the next steps, actions, by identifying priorities for course of action. This process should be intentional and organic. Stage 2, supporting organisational change. Developing the plan. The AIWG uses a number of planning tools, checklists and references to assist the audit to develop a strategic plan and identify goals for implementing organisational change. Developing the plan needs to several factors to look at. Identifying strengths, weaknesses, opportunities, benefits and potential challenges. Provide an overview of goals and objectives. This would include workforce development strategies for recruiting, hiring, retaining, training, upskilling and supervising. Consumer, carer participation and peer workforce support in implementation strategies. Policies, procedures and practices to support a TICP approach that is culturally responsive, and strategies to amend facility design or environment to reinforce safety. Stage 2, supporting organisational change. Developing the plan. The AIWG uses a number of planning tools, checklists and references to assist the audit to develop a strategic plan and identify goals for implementing organisational change. Developing the plan needs to several factors to look at. Identifying strengths, weaknesses, opportunities, benefits and potential challenges. Provide an overview of goals and objectives. This would include workforce development strategies for recruiting, hiring, retaining, training, upskilling and supervising, consumer carer participation and peer workforce support in implementation strategies, policies, procedures and practices to support a TICP approach that is culturally responsive, and strategies to amend facility design or environment to reinforce safety. Establishing guidelines for implementation. These should highlight the specific steps, roles, responsibilities, and timeframes for each activity to meet TICP objectives. They should specify how the service will be monitored, gather data, evaluate and measure outcomes and processes, and also should consider whether to include a trauma-informed care and practice approach in a mission or vision statement. Stage 3, implementing trauma-informed policy and practice. The implementation process builds on the QI improvement processes for an organisation. The next step is implementing the plan, then reassess the new plan, and then evaluate the outcomes and determine if new goals and objectives or additional problems or issues need to be addressed.
Trauma-informed care approach. How trauma impacts the brain. Trauma can affect the brain's neurological pathways and increase the risk of developing behavioural, emotional and mental health issues, even more so if the trauma occurred during childhood. When trauma happens, a surge of cortisol rushes through the body and sends blood to your muscles, making you tense up and send you into the fight, freeze or flight mode. After the initial impact of trauma, the individual may suffer from PTSD, post-traumatic stress disorder, and be unable to feel safe as they are always stuck in the fight, freeze or flight mode, being on edge constantly, thinking there is danger. Individuals with PTSD will experience intense emotions, painful thoughts, flashbacks, insomnia, feel anxious, ashamed, and have panic attacks. This is a response of constantly being on edge and not being able to feel safe. After trauma, your hippocampus part of your brain shrinks. This part is associated with processing emotions and memories. Essentially, after trauma stress, hormones kill off the cells in this hippocampus, making it less effective for processing emotions. Trauma affects children in many ways, through things such as domestic violence and constantly suffering interpersonal trauma, sexual abuse or psychological abuse. They can also suffer physical and even abuse within the community or school they attend, or even experiencing lifelong changes. At birth, we are born with a very basic memory system that assists us automatically to encode not only our early attachment experiences, but also any traumatic experiences. Exposures to negative experiences can suppress the neural pathway development and integration, especially between parts of the brain, such as the cerebral cortex, thinking and reasoning part of the brain, and the limbic system, controlling their feelings and physical responses. This then causes developmental trauma, and the child may suffer from learning and behavioural problems. As a child cannot turn off their primitive brain as they are stuck in survival mode, these children may go on to experience long-term health issues and disease, may suffer from substance abuse, homelessness, risky sexual behaviours that may lead to sexually transmitted diseases such as HIV, and they may also have problems with the criminal justice system. They may even go on to reenact the trauma on someone else, thus just repeating the cycle. Trauma can be repaired at a young age with the right help. If the families, the school, the counsellor, or support workers work together as a team, the child can begin to heal and feel safe again. Intergenerational and historical trauma. Intergenerational trauma is passed on through one generation to the next in many forms. Trauma affects our brain and how we respond to stresses. Ongoing and repetitive trauma makes a person and their children more sensitive to future traumas, and this affects the environment around them and how they think, act, and behave. They become disconnected socially and emotionally, which then leads to disconnections of future generations. Intergenerational and historical trauma is more prevalent in the Aboriginal and Torres Strait Islander communities. Since colonisation began, they were overcome with disease, bad health, their land was stolen from them, and their children taken away and abused, emotionally, physically, and sexually, and they had their identities and culture stripped from them. This has caused significant intergenerational trauma within those communities and families, and the wound runs deep through generations of unhealed trauma. This has led to disconnected families, broken relationships, suicide, violence, and drug and alcohol abuse, as well as having issues with the criminal justice system. Trauma can impact on anyone, not just the Aboriginal and Torres Strait Islander communities, and those affected by trauma can act it out onto others, as that is all they have known how to behave, and they do not know how to properly regulate their emotions. This can show up in many forms of domestic violence and substance abuse and trouble with the criminal justice system. This then creates generational trauma as it is not being healed and passed on down through their children. By supporting these families in a culturally safe environment, they can begin to feel connected to the culture and start to feel like they belong again, to stop the cycle of trauma, to bring generational change where the children and families can begin to be happy. Thank you for listening. The end.
Thank you, Danielle. So now moving on to the next topic, which is re-traumatization. So re-traumatization is when a trauma survivor is triggered and they end up re-experiencing the initial trauma point as if it were happening again. And this can result in those really acute symptoms of distress. It's a bit different to re-victimization, wherein a trauma survivor experiences the same trauma for real. And when we talk about triggers and distress tolerance, most people that have experienced trauma will have a window of tolerance, right, where they can be triggered, but they are able to manage that distress. So when somebody is re-traumatized, that distress lies outside of that window of tolerance, and it can be really disruptive to somebody's life. If they have a predisposition to psychotic symptoms, it can lead to psychosis, which can mean further risk of harm, hospitalization, which comes with its own issues, as hospital and healthcare settings can be traumatizing or re-traumatizing in their own way, particularly if somebody ends up in involuntary admission. And it's unfortunately common in service delivery, which is why we need to be aware of the signs and symptoms. I won't go into too much detail because they are essentially the same sorts of things that we are familiar with in PTSD. So something to look out for is if somebody does present relatively stable, or maybe they only experience a few of these symptoms and then there is a very drastic change and they start experiencing many more or most of these symptoms, then you might want to consider that there has been an incidence of re-traumatization. And there are a lot of things that can make somebody more vulnerable and put them at risk, and some of that is just general life stress. So if somebody is experiencing challenges in their work, family, if they're lonely, that can leave them susceptible. All of the usual sorts of triggers that we would be familiar with, and something to focus on in our service delivery setting is that discussing traumatic events in detail can be very re-traumatizing, which is why we never push somebody to disclose if they're not ready. And even sometimes if they are ready and they end up talking about their trauma, if we notice that they're becoming quite distressed or agitated, we may want to just very gently refocus the discussion and manage their distress as it comes up. So medical and institutional settings, as I've mentioned, can be re-traumatizing. So if somebody has a hospital visit, dentist visits, anything that involves feelings of physical vulnerability, or, power dynamics. Somebody may, or, maybe removal of clothing, maybe they're getting a skin check, or being in a room with an unknown member of the opposite sex. Interpersonal relationships, unhealthy ones, they can certainly be re-traumatizing for anybody that has relational interpersonal trauma. And discrimination, racism, cultural insensitivity, dehumanization. So to minimize these risks, we need to take the approach that anybody that walks through our doors has a trauma history. And it mostly means adhering to the principles that we have discussed. So most importantly, we collaborate with our clients. So we ask them what makes them feel safe, what makes them feel in control, what their triggers are, what distress tolerance skills might work for them. We need to be sure that we respond appropriately to disclosure, so we never dismiss it. We take things seriously. We never make anybody feel like they don't matter. And if they do mention any ongoing safety concerns, domestic violence, then we address that appropriately with referrals to specialised services. And obviously the requirements of mandatory reporting still apply. So we would also be sure to collaborate and coordinate with within our organisation and also external services. And obviously with respect to clients' consent, privacy and confidentiality, it may mean discussing with external services the client's story so that they don't have to if they don't want to, so they don't have to keep repeating things that they don't want to talk about. Community and cultural awareness. So as we have previously stated, just be sure that we recognise that trauma goes beyond the personal level and be aware of, poverty, systemic injustice, historic events, important dates that may be significant to somebody of a certain culture, and obviously avoiding harmful practices. So that's judgmental attitudes, labeling people, treating somebody as a diagnosis instead of holistically as a human being, stereotyping, and of course restraint, seclusion, and coercive practices. We do our best to make sure that never happens to somebody. So that concludes my section on re-traumatization, and I will now pass you on to Sonia, who will talk about implementing trauma-informed care. Thanks, Robbyn. So we're now on to the last part of the presentation, which is on the topic of collaboration in trauma-informed care. So what is collaboration? It's essentially working together. It's combining everybody's respective views, skill sets, and strengths to work more effectively. And this is done in the spirit of partnership, mutual respect, and dignity for all. So this can mean engaging clients and their families, as well as services, stakeholders, and collaboration can occur on an interpersonal level, an organizational level, and a systems level. It can also involve balancing power differentials so that everybody feels like they're on the same level. And why is collaboration important in trauma-informed care? Well, anybody that's worked in a therapeutic setting has probably heard the phrase, damage caused in relationship can be healed in relationship. And we think that applies to trauma-informed care as well. Often trauma survivors have had their trust and their ability to collaborate destroyed in traumatic events. And this can manifest in feelings of unworthiness of working with other people and trusting other people. And that can really hinder somebody's search for belonging and purpose. Some people that have sustained trauma may not have had effective collaboration and healthy, trusting relationships modeled to them before. And collaboration can enhance feelings of self-worth, belonging, and recovery. And also, if we effectively integrate our care, this can foster more engagement and just produce better outcomes for service users. So what does this look like? So many of the principles we've already discussed. Empowerment is important. So we collaborate with clients and recognize them as experts in their own life rather than taking the reins and telling them what to do. And we support them to plan their own recovery, and they can have their individual needs understood. We can also work with their families and other stakeholders. Anybody that might have some helpful perspective to share. It can mean trust building. So we need to foster trust between consumers and providers, and we do this by providing safe environments and relationships that are based off of respect and dignity. We respect their rights, their privacy, their confidentiality, and we make sure that we're consistent in our approach, that we follow through and we don't leave anybody feeling like they're not thought of or they've been forgotten about. We also collaborate and communicate with other services. We might need to discuss and refer clients on to other services, and that can involve working together as a team to support that client. It also means we support people through group work and peer-led spaces. That can be really helpful for somebody that's recovering from trauma, to work with people that have an understanding of where they're coming from. And lastly, collaboration involves taking a holistic approach. So that is comprehensive care, where we address the entire person, their physical, emotional, social, cultural, and spiritual well-being. This means just treating them as an individual instead of a diagnosis or the thing that's happened to them. And that concludes the presentation. So thank you so much for listening, and we'll now leave some time for questions and answers if anybody is interested in asking them. Thank you.